Chairman of the Jagannath Institute of Medical Sciences and Hospital, has played a pivotal role in strengthening both medical education and healthcare infrastructure. His leadership has supported the development of future medical professionals alongside the expansion of institutional capabilities. He continues to contribute to building a more robust and accessible healthcare framework. Mr. Krishna Kumar Gupta for strengthening medical education and expanding healthcare infrastructure in Eastern India. Requesting Mr. Gupta to kindly have a seat.
You see that we always talk about, when it comes to health, we talk about health as per that when the patient comes to the hospital or जब ICU में आता है, then we talk about कि चाहिए medicine देना, वो दवाइयाँ देनी है. Whereas the holistic approach has already been existing in our ecosystem since last 5,000 years, as ma'am has just said. That the Ayurveda, yoga, meditations, let's say Unani, there are so many other forms of treatment which was already going on. It was just forgotten until a couple of years back, since we have started this to bring into the forefront. Now with the modern medicines, we are in a great position now to integrate them together for a complete approach, so that patient not only comes just for the sake of treating that one disease. Disease does not happen on a day, it's an accident happen on a day, but diseases does not happen in a day. It involves how you eat, how you live, what is the background in which you stress, you manage it, what is the kind of upcoming. So there are so many other dimensions involved which neither we have talked about, nor we discussed that with our doctors, neither our doctors were trained for that. Now, because we are in a medical college which is into a profession of not only treating but also into a profession of teaching how to treat, if we are able to inculcate ideas among the students when they are being taught, a lot of difference can be created at that point of time. To do that, what we have done is that now in the regular classes, we have already started the approach of having special classes. All our students are now being taught about empathy classes. We are teaching them counseling of patient classes. We don't teach all these things, it's not there in the syllabus. Our students now are adopting 5 homes in the villages. They are going to the villages, they are seeing the home, what is the kind of lifestyle they are living at, what is the socio-economic background that they are coming with, so that the students can know that if the patient is coming from such background, what other prospective diseases can be. If the patient is coming from X background, what are the probable causes of disease can be. So at the level of academics, we are trying to inculcate those habits. The history taking starts right from the age of 20. Cardiac disease doesn't come just attack came एक दिन आ गया और हम medicine खाने ठीक नहीं होता है. Most of the disease starts at the 20 years when you are age, or before that also on many occasions. When we reach 50, 60, realize कि सारा block हो चुका है. हुआ तो बहुत पहले से है. Now if we would have been teaching the students, the teachers, the doctors, the patient, preventing them would have been a lot more easier. And then treating them holistically would have been a lot more easier. Playing of psychiatric or playing of nutrition or playing of physiotherapy right at the OPD level instead of post-treatment level. If we are able to integrate that in our IPD system, in our OPD, while the patient is going back home or when they are coming back, what to eat, customize that. What to exercise, to customize that. If we are able to inculcate these things on day-to-day treatment pedagogy, things would definitely change and improve, I'm sure.
I love that part where you said every student has adopted 5 homes each, and then they go and kind of live with them, I would say, because I think the only difference is they are not staying with them, otherwise they are living with those 5 families. And that is such a wonderful approach, I must say that. I have another question, sir. Well, did I hear a round of applause? Then it should be louder, please. Because that's a lovely approach. So I have another question. As the chairman of a leading medical institution, how do you see the concept of holistic wellness being integrated into mainstream hospital care today? You have partly already answered that, but if you could just put some more light into that.
You see that when the patients in my hospital, what we have tried to do is that a patient, when they come to the OPD, they don't straight away go to the doctor directly. Before they go to the doctor, what we have tried to do is that they also visit the psychiatrists, that what are the things that is happening before they are inculcated in the diseases. they are also being exposed to the nutritionist. What are the things, what are the food habits, what are the things for which these problems have come up with. So the psychiatrist and the physiotherapy, apart from the nurses who are taking their history, the history is also embedded in a good HMIS, in which the patient's entire database is being drawn by HMIS. We are also in talk with various technological companies if we can have a AI module involved into the history taking process, that in the last so many years, whatever their food habit was, what are the things that can get influencing their diseases. So these are certain things that we have been able to bring in our OPD. Same in the IPD as well. We have been able to again attract a lot of such mechanism in the IPDs, wherein the total health of the patient is being assessed, for which again the counseling, the doctor's counseling, nurses counseling, empathetically trying to understand the patient from where they have been able to come, what is the kind of diseases that they have been able to acquire from ages, and what are the rest of the solution can be. घर जा करके सिर्फ दवाइयाँ खाना है, या there are various yogas, asanas, as ma'am was talking about, chakras, a new concept of dimension, whether if we can able to adapt them. So huge dimension is slowly evolving, and we are rightly going to participate and going to involve whatever it is feasible in a medical fraternity.
Thank you very much, sir.